After completing my medical training in New York and Baltimore, and worked in Brazil for a year in a Cambodian refugee camp, I returned to New York to begin my academic career focusing on tropical medicine. But as I tell my students today, everyone needs a career plan, but everybody needs to be ready to change that plan if the appropriate opportunity arises. I had trained to be a specialist in infectious diseases. In the best academic tradition, I worked in a parasitology laboratory and was assigned an obscure parasite to determine what its impact was on human health. In 1979, however, an unexpected event occurred which would change my life and be the harbinger of a global catastrophe. During my first month as a faculty member in New York, I was called to see a young man who was dying of pneumonia despite all the antibiotics that we could throw at him. We eventually did a lung biopsy in this man, and to everybody's surprise, we found that an obscure organism, Pneumocystis carinii, was the cause of his pneumonia, the very same organism that I was studying in the laboratory. This organism had never before caused disease in a previously healthy human. As we evaluated this patient, we found other similar patients in New York, and we heard of similar patients in Los Angeles who are studying and who are being studied for the same mysterious ailment. These intriguing patients were described in a 1981 issue of the New England Journal of Medicine and were the first report of a syndrome we now know as AIDS. The number of cases of AIDS in New York, Los Angeles, and major other coastal cities quickly escalated, causing fear, consternation, and in the scientific community, curiosity. I was invited to consider a radical change in career plans. Rather than splitting my time between a university parasitology laboratory in Brazil, I was offered an opportunity to come to take a job at the National Institutes of Health, and I had a career choice to make. The decision to come to NIH was not easy. NIH was a world-class opportunity, and it was a real professional opportunity. On the other hand, my father had worked at NIH for 20 years. He had been the founding director of the hospital and had an auditorium named for him after he had died 10 years previously. I did not want anybody to assume that I was going to NIH because of family connections, but working at NIH was a real opportunity. After a few nanoseconds of thought and consultation with my wife, I decided to seize this new opportunity and leave tropical medicine behind. I wanted to become an expert in AIDS. In order to make that decision, I decided to do what most people do naturally. I consulted the leadership of my organization, the dean and the director of the hospital, and asked what advice they had for me as to whether I should pursue AIDS in New York or in Washington, D.C. The chairman and the hospital director were quite clear about their strategic plan. Much as they claimed they liked me as a faculty member, they had no desire to have their institution known as a center for AIDS. The 1980s were a time when attitudes towards homosexuality and AIDS were tinged with fear, misunderstanding, and a wishful attitude that maybe this whole problem would go away. Their advice to me was to move to Bethesda as quickly as possible and to take my team and my patients with me. Thus, I moved back to Washington to begin my work, and I've been at NIH for 25 years as the director of the intensive care unit, working also to develop a program to improve the prognosis for patients with this dreaded disease. Working on the AIDS epidemic over these 2+ decades has been a tragic yet in many ways exhilarating opportunity to see the intersection of basic science, clinical medicine, and public policy. Scientists working with AIDS at the NIH discovered the AIDS virus, probably, developed the first blood test, developed the first drug to treat HIV, and made a host of other research findings that have improved the care of patients worldwide. I think that the federal AIDS effort to advance science and to quickly translate research into improved care for patients was an example of the federal government at its best. NIH has served the country and the world well. Scientists have also been important not only for doing this research, but for also being agents for social and administrative change, inviting activists from a wide variety of communities to join advisory boards in speeding a host of government processes so that they can more effectively bring these advances to patients who needed them. These accomplishments show that your federal tax dollars can be used wisely and successfully. As Sidwell students can see living in Washington, interacting with their parents and neighbors, career in the federal government can be rewarding and consequential. The federal workforce is graying. This is an era when we need to recruit the most dynamic, energetic, and visionary young people that we can into our departments and agencies. I'm sure that Sidwell students will see these opportunities and take advantage of these careers, which I think can have so much impact. Much has changed over the last 25 years, both in AIDS and at Sidwell. With regard to AIDS, treatment is dramatically better. After 25 years, we have over 24 drugs, patients can take 1 pill a day, and many patients will outlive their HIV, dying of the maladies of old age rather than their HIV directly. With regard to Sidwell, the school is substantially better than even the fine institution that we knew in the 1950s and 1960s. There is a far more diverse student body and a far more talented faculty than the 1950s and 1960s had. These students and faculty are not only engaged in rigorous and sophisticated academics, but they're also activists in local, national, and global problems, far more than we ever conceived of in our era. My youngest daughter graduated from Sidwell last June. As a parent, I could see the rigorous academics, I could see the social activism of this diverse community, and even in the field of HIV, the AIDS Club, the trips downtown to do social service, and the trips to Africa to help patients with HIV are examples of the global perspective that Sidwell has. I look at Sidwell now from the perspective of having been a student, an alumnus, and a parent. I'm proud of the school that was, and I'm particularly proud of the school that is in 2009. Bruce Stewart, the other honoree today, deserves immense credit for populating Sidwell with teachers, staff, and coaches who are having the same lifelong impact on these students that Corinne Rosebrook, Charlie Wannen, Harvey LaSure, and Jeff Forsyth had on our generation. I would name the faculty today that my daughter had as favorites, but there are really too many of them to name. I thank the Alumni Association, Bruce Stewart, and the entire Sidwell community for this opportunity to talk to you and for being chosen as the distinguished alumnus. I'm sorry I couldn't be with you in Washington for this event. Thanks very much.